Name's Mrs Hawthorne, and as most of you know, I teach health and social care at Key Stage 4. This presentation is just to take you through the kind of things we do within health and social care, and if you decide to opt for it, the kind of work you'll be completing. Why study health and social care? The health and social care sector is one of the largest employment sectors in the UK. So we all think of doctors and nurses, but there are care workers, childcare workers in nurseries, auxiliary staff, domiciliary carers. There is loads and loads and loads of jobs which we do look at in the first part of health and social care. And if you want to make a positive difference in society and want to help people, then this is probably the kind of course you want to go on to. If also you want a secure employment, so jobs that will always be there, the health and social care sector is not going anywhere. There will always be jobs in this sector. In health and social care course, there's 3 separate components that we work on. Component 1 is called Human Lifespan Development, Component 2 is Health and Social Care Services and Values, and Component 3 pulls together both Component 1 and 2 and builds on that and is called Health and Wellbeing. Component 1, Human Lifespan Development, is internally assessed, which means within class you do some coursework, and I mark it, and then it's sent to a moderator to make sure that everything's there. But it's done in school, the coursework, and you've got to write a report, and your report is based on a person. Now that could be a person you know, or it could be a celebrity, and you have to look at that person and look at 3 different life stages of that person and how they develop. So how they develop physically, intellectually, emotionally and socially. And then you look at different life events and different things that might have affected their development, either positively or negatively. If you want to click on the link to the YouTube video, there's a little bit more information on Component 1. So Component 1 split into 2 learning aims, there's A and B, so there's 2 different reports that you will write. Learning aim A, you will research a celebrity, but it can be somebody you know as well, but you have to anonymise it, so that person's details are kept confidential. And then learning aim B, you identify 2 people who've been through the same life event, so that could be becoming a parent, it could be getting a job, going to prison, and you write a report on how both of those people have adapted to that life event and the support they are given. Then we move on to Component 2. We do this in Year 10 as well, and it's Health and Social Care Values. Again, it's another internally assessed unit, so it's coursework that you will do in class, and it's 2 reports you will write, and you look at case studies of 2 different people, and you look at the different kind of health and social care services that these people should be accessing. So they might need a doctor, they might need a physiotherapist, and you look at what they need and why they need it, and then you look at what might stop them accessing those services and how those barriers can be overcome. Again, there's a YouTube video there that gives you more information about that unit. So Component 2 again is split into 2 learning aims. Learning aim B, as I've already said, is about looking at 2 case studies of 2 people who live together, so it might be a husband and wife, or it might be a parent and child. And learning aim B, you work in teams and you create a role play, and the role play is you're given a case study, and in the role play you have to demonstrate you can meet all of the care values. Component 3 is the externally assessed unit, so that is the exam unit. That's where you'll sit in the hall and do an exam. The exam brings all of your knowledge from Component 1 and 2 and adds a little bit more to it as well, and it's all about how we can improve somebody's health and well-being and how we know if their health and well-being is not very good, why it's not very good, and what we can do to make that better. The exam's split into two sections, A and B, and there's a total of 60 marks split right down the middle. So section A, assessing health and well-being, is 30 marks, and section B is designing a health and well-being improvement plan, and that is also 30 marks. Section A, you're given a case study, so you're given lots of information about somebody, and then you're asked a set of questions based on that case study, and it's all based on their health and well-being. Section B, you're then given some extra information about the same person, and you're asked to write a health and wellbeing improvement plan to make their health and wellbeing better. And you have to look at all the information you've previously been given about what's going wrong with their health and wellbeing, and then you have to put recommendations in place as to what you think they could do to make their life and their health and wellbeing better. So loads of things you need to know throughout the whole course, but these are just some of them. Specifically, these are used in the exam for component 3. Post-16 opportunities, there's lots and lots of things. We've seen students go on to do health and social care at college. We've seen students go on to do like going into the care field, going to work in nurseries. We've seen students going to university to do health and social care at university. We've seen students going on to nursing. So there are lots. And if you're interested in these kind of things that we've talked about, or you're interested in going into the care sector when you're older after school, then this would be the course you should take.